So my next question here is, if a patient is on lipid-lowering therapy, but their LDL cholesterol levels remain above target, what would be the next steps there?
Yeah, you mean like if they're on a statin like Crestor or Lipitor, then you would talk about using ezetimibe as the next step. And these drugs are cheap, so that's what's beneficial. Is I pretty much have everybody on a statin and ezetimibe to start with because it's cheap and easy, and they work very well together. You get a 20% reduction with Zetia, and the statins will reduce the LDL anywhere between 30 and 50%, depending on the potency. One thing that South Asians have to be concerned about a little bit is they have higher levels of the statin medicine uh, at lower doses. So we usually kind of have to start at lower doses with South Asians. So like 5 milligrams of Crestor and no more than 20 is something that's talked about. So the PCSK9 inhibitors are the next step, which are injectables that lower LDL cholesterol further dramatically with very low side effect profile, and like 50 to 60% really can get the LDL down to those 30, 40 levels that we talk about for the extremely high risk South Asian. So yeah, those are the big three. We have long acting drugs called inclisiran that is twice a year drug that is useful. It's also an inhibitor of PCSK9, which helps the LDL receptors that take the cholesterol out of the bloodstream into the liver and dispose of it, recycle. So there are more of the receptors on the liver. Those are kind of the main drugs that are used right now. Newer ones coming to the market in the next few years.
Awesome.